Welcome to the Power of One. Today, I have the pleasure of speaking with Dr. Tedaldi. Dr. Tedaldi is going to explain to us all of the great work that she has done in the 80s and that she's continuing to do today to help those affected by HIV. Welcome to the show.
Thank you.
Doctor, tell us a little bit about your medical career.
Well, I did my college and medical school in New York, did my training in Minneapolis, Minnesota, and then returned to New York and began my initial medical career in New York City at Columbia Presbyterian. And then I've been at Temple since 1986. So
Okay.
almost more
All
Philadelphian than a New Yorker.
Okay. All right. So, Doc, in the 80s, the early 80s, did you and your colleagues begin to see something that was a little mind-boggling? And what did you discover it was?
Well, I would say what all of us were seeing, and this, I would say my experience started around 84, were people coming in with unusual pneumonias, cancers, and recurrent, what we would call now opportunistic infections. That generally meant that their immune system was really in disarray. And these were otherwise, in the most part, young people. So they were coming in with unusual conditions and trying to understand what was happening to their immune system that made them at risk to get these, various conditions.
Now, was it already named? And when these people were coming to your office, did you and your colleagues already know what it was?
The name, it originally started out as GRID, gay-related immune deficiency. It was first identified at like 81, and then around 83, more 84, they actually gave it a name. Human immunodeficiency virus, or HIV, also acquired immune deficiency syndrome. So the HIV AIDS started around 84. What that meant in terms of what were the conditions that meant you have this particular disease were just really evolving, because in the beginning, some diseases weren't recognized as being part of HIV AIDS. So that continued to evolve over that time. But it was, really, certainly working in New York City, one of the highest hit, centers, we were seeing a lot of people coming in, mainly to the hospital, because they would end up coming in sick. We didn't have testing at that time. We didn't have a test until like 1985.
So did the COVID pandemic and what we went through now, and I know that's not your area of expertise, but here it is, you have this illness that's just coming and doctors are not familiar with what it is and they're trying to treat it because it's new. Was it something like that?
Yeah, there's a lot of parallels between what we saw in COVID and what we saw in the beginning of the HIV epidemic. But I think even more so, people were very afraid because they weren't sure like exactly how is it transmitted. So there was sort of some of the same misinformation, same stigma. I think eventually with COVID, they obviously identified early on, but in terms of the volume of people coming into hospitals impacted by a particular condition, yeah, it was, at least certainly in urban centers and certain areas of the country where you would see high volume of people coming in with HIV related complications.
So, Dr. Tedaldi, with HIV, I see, I'm going to speak about me. I see HIV/AIDS. Is there a difference, or are they both one and the same?
They're caused by the same virus, the human immunodeficiency virus. And in the beginning, there was often this artificial distinction about, oh, I just have HIV. Oh, I'm full-blown AIDS. It's the same infection. It just depends on at what point are you looking at it. And in fact, now we don't use that term full-blown. We say either advanced or early. It depends on, where we can determine the patient's blood levels are and their particular conditions. But AIDS then came to refer to a vast number of very specific diagnoses, or if your blood work showed your T cell count, which is one of the immune markers, had fallen below 200, then you were classified as having AIDS. So it's all part of the same infection. It just depends where on the spectrum you're watching or seeing that patient come in.
How did it get to the point where people were afraid to interact with, to hug or touch someone who was diagnosed with HIV or AIDS? How did it get to that point? Do you know?
Well, it got there very quickly because people did not understand how it was transmitted or what was really needed to have transmission of the virus. So people just assumed like literally being in the room, touching, kissing would be sufficient. And as part of that, that was one part of the stigma that resulted in how people were treated. And then it was also, as it became known how it was transmitted, that people were also stigmatized because it was far and away a sexually transmitted disease or related to drug use. And so there was a stigma attached to, why do you have that particular infection? Or if you, certainly I saw lots of women in the beginning, a lot of them sort of very negative attitudes about how they may have acquired their infection.
And that's what I was going to ask. So did you see a specific population that was coming? And what about a specific race? Does HIV/AIDS affect African Americans more than it does any other race?
Much more so. It is really yet another example of health disparities, and there's some very detailed explanations about why we think that came to be, but a lot of it rooted, as you might imagine, in terms of racism, poverty, social determinants. But the overall epidemic in the US is far and away impacting communities of color. Probably about, like even in our practice, like about 3/4 African American, 20% Latino, and then sort of a different, sort of ethnic group. But it definitely, and if you look around the country where there's been recent major increases, Southeast US, that is all in communities of far and away communities of color.
Now, Magic Johnson was diagnosed, and you indicated that it used to be called, what did you say?
Well, early on it was called GRID, gay-related immune deficiency, and then it became known as HIV.
HIV or AIDS. So we know he's married, and we won't make the speculation of him being gay or using drugs. Is there another way to contract HIV or AIDS, other than being gay or through drug use?
It's far and away these days a sexual contact with someone who's carrying the virus. So, I mean, we all speculate about the stars, and they have lots of, sexual contacts. I mean, he could have technically gotten it from a female contact as well. There's really, I think because of that, a lot of speculation, and that's what happens. There's a lot of misinformation. And it's really, it's sort of, I say it's like real estate. If you're living in a community where there's a lot of HIV around, you're likely in your sexual network to run into somebody that may have it, who doesn't know it and can pass it on. Or that would include also in those who are using drugs. Again, lots of behaviors there that may increase your risk for, especially if it's, using needles, sharing needles, stuff like that. So yeah, there's really, I think people get cast with a lot of negative assumptions about how they may have acquired it.
Okay. So if we have a pregnant mother who has HIV AIDS, she can pass it to her child, and her child can be born with HIV AIDS?
She can if she doesn't get treated, but that was one of the major public health breakthroughs in 1994, treating pregnant women with AZT, or an antiretroviral, as we call it, and successfully reduced the risk to her unborn child. And so that now in the United States, and that used to be like a 1 in 4 chance. Now in the United States, the vast majority of pregnant women who might be living with HIV, it's less than 1%. So you can pretty much guarantee having an uninfected child. The unfortunate transmissions that we do see are often related to lack of prenatal care or lack of, being engaged in good prenatal services. Yeah.
Doc, when this first came out and it took you and your colleagues by storm, did you see a lot of deaths surrounding this illness?
Yes. It used to be, certainly before the first drug became available in 1987, it was, fairly routine to know that once you made the diagnosis, that person was probably not going to survive. But that didn't apply to everybody. But it was, far and away assumed to be fatal until we got effective therapy. And now it's not that at all. You can live a full life.
Right. Now, when it first came out, people would have to take a whole cocktail of drugs. Correct me if I'm wrong. And now they can take one pill a day, or even a shot for a couple of months.
Yeah.
Expand on that.
Yeah. So the treatment of HIV is a lot of starts and stops, but essentially there were new drugs developed almost every year, but we didn't know how to use them. I mean, people were desperate. So you'd start with one drug, then you might do the second drug. And then we realized all we were doing was allowing the virus to grow resistant. So eventually they developed what came to be known as the cocktail. So 3 or 4 medicines. But unfortunately, in the beginning, that meant lots of pills, just in order to be able to get it at work at different parts of the cycle of the virus. And then now, in the 30 years since, we now have single tab. In fact, most people only begin as soon as they're diagnosed with a single tablet. And then if you're controlled, then we can talk about doing the every 2-month injections, which is, absolutely amazing to think that you could just stop by the office.
Right. Coming from that whole cocktail to this. Now, speak about being undetectable. Did I say that right?
Correct. Yes,
Okay.
that is another game changer. So with these new medicines, the way we assess where are you with your HIV, we measure 2 things. We measure literally how much virus is in your blood, what we call viral copies. We also measure your white blood cells, which are called CD4 cells or T cells. So you want a lot of white cells to fight infection, and you don't want any virus in your blood. So if you can treat with the medications now, they effectively shut down like the factory of HIV. So you don't make any more HIV. It's still there, but you don't make any. Then you become undetectable when your blood levels are no longer able to be measured by the lab. And with that, the other major part of that is you are no longer infectious for a sexual partner. So once you're undetectable, you can't pass that virus on to your sexual partners or your infant, or ideally if you were sharing needles. But that's the big news. So the goal is to get undetectable.
Okay. Is HIV/AIDS curable, or it's treatable?
It's treatable. It's not yet curable. There is a phenomenal amount of research going on to try and cure it. And everyone always asks that question. Well, you got a vaccine against, COVID in a year. Why don't we have a vaccine against HIV? HIV, in a nutshell, changes much more. It's the way its structure is. It can, hide out and not be affected by vaccines. And it hides out in various parts of the body, your brain, your organs. And so if you don't take medicine, the virus, says, oh, no one's around. So that'll come out and start growing again. So you need something to keep it under control, which is what the medicines serve to do. Yeah. And wait for the cure.
Okay. Okay. I often see a commercial called PrEP.
Yes.
And in the commercial, they'll talk about PrEP and how you can take PrEP and still be intimate with your partner. But then I always wait for those side effects. And I mean, come on, Doc. In some of these commercials, I'm like, they're like, oh, you have this and you can take this, but the side effects are like, and I'm like, well, okay, so I'll just stick with what I have because the side effects they just sound so
Yeah.
much worse than what I actually have. But when I listened to the PrEP commercial, the thing that stood out to me the most was kidney failure. Like
Yeah.
how speak about PrEP and like does it really affect people that much to where they'll have kidney failure?
Great question, because that is a lot of people's concern. A, why should I take a medicine that, I don't have this condition? So the whole concept of prevention is a thing. And B, take a medicine that may have side effects, because every medicine has a side effect.
Right.
There is a theoretical risk of affecting your kidneys, affecting your bones. That's why you're, like anything else, you're monitored. There are different types of PrEP. There's the one that's approved. Here's the discrepancy: only for that women can use, which has a little bit more of a risk, maybe, of impacting the kidneys. But again, you're not talking about 10-20%. It's really, you just have to, be monitored. And then there's an injectable one, which everyone is really hoping could get more popular, because again, you're talking about, it's an injection, but you're taking it every couple of months, not having to take a pill every day, trying to remember it and all that. But they all theoretically come with side effects. And that's why it's important to just be under monitoring. I think the challenges are having to take something every day as a prevention.
Right.
And men can do variations of the PrEP. They don't necessarily have to take it every day. They can sort of do like what we call on demand. Like if they have a sexual exposure, they can take certain number of pills afterwards. But it doesn't work that way for women. And I think part of it is a lot of things about PrEP. It's very effective, but people perceiving that they're at risk. Well, I don't think I'm going to be exposed, so why should I take it?
Right.
But
Right.
in fact, you may well be exposed. Yeah, it's a
So
very
that's the thing.
challenging area. And then you also have to have access to healthcare. You have to have insurance, although it's covered by most insurances and stuff, but there's still some barriers to using it, which is a shame.
Do you find that transmission of HIV AIDS is more so with the male than with the female? Or that's something that you guys don't know yet?
Male to female or male to male?
Well, what I'm saying is, so say if there is a male who has HIV and he has intercourse with a female, or there's a female who has HIV and she has intercourse with a male, both unprotected. Is the chances is higher for a male to transport it to a female than a female to transport it to a male?
Yeah, a lot of that was, I think, topic that we had earlier on in the epidemic, because we didn't have effective treatment. So in general, it was thought, well, the male may have a higher volume of HIV in their semen versus a woman in her vagina. But it really all depended on what stage. And now a lot of that is really, with getting people on medicine and undetectable, less of the issue. But in terms of the overall risk, we know that men who have sex with men, and again, unfortunately, in communities of color, is very high because of lack of treatment, or lack of people being aware and being on treatment. So it really depends on what your viral level is, how infectious you are for your partner.
Now, the deaths have dramatically dropped over the years, and one can live a normal life if they have HIV or AIDS?
Yes. The main things I say yes, because we often tell the patients HIV will not be your cause of death. But
Mm,
if you keep smoking, or if
mhm,
we can't work
mhm.
on your high blood pressure and your diabetes, the good news is HIV is going to allow you to live a long life. But guess what? You get to get what everybody else has along with,
Right.
you get to live long enough to develop,
Other
arthritis,
diseases.
other
Yeah.
diseases, along with the rest of the world.
Right, because your body just listen. My body ain't what it used to be. Like I'm going down the steps, and I'm like, why is my knee feeling like this? It's just
Yeah.
horrible. My dad has arthritis, and I said, oh my goodness, I know he just passed it right on to me. Now, so with HIV slash AIDS, is it a concern, like if someone goes to the dentist, if they go somewhere and they have to have work done and blood may be a factor?
Hmm.
Should dentists or other healthcare professionals, paramedics, should they be concerned about that?
Yeah, I mean, certainly at the beginning, there was always a lot of, fear or whatever. We are now, I mean, the one advantage, or what would we say, public health measure, is you have to assume everyone is potentially carrying some infection. So gloves, masks, whatever as the case may be. Certainly in COVID, we all got used to that. But no, usually as long as they're uh, under treatment and reasonably controlled, there's no risk to the dentist. And if you've ever been to a dentist now, you feel like everyone's in like hazmat
You're
suits.
right.
And,
Yeah,
yeah,
you're
goggles for
right.
everybody.
Right. So, Doc, tell me something. So just say I am exposed to someone who has HIV AIDS and they're not detectable, but I am exposed to it. Is there some type of medication that I can take that you can say, listen, you take this for 90 days and you'll be good. You won't get it at all. Does something like that exist?
Yeah, there's what's called PEP, which is post-exposure prophylaxis. PrEP is pre-exposure. So you take
Mm,
something to prevent, just in case you have a sexual contact with someone that has HIV. PEP is post-exposure, sort of like the concept of the morning after pill. You can take medication for a period of time, either if you don't know, but you're concerned that you might have been exposed, then usually take it for a month afterwards. If in some cases, like it happens in healthcare, you may have an exposure, but then you can eventually find out, that person was undetectable. So, your risk is really reduced. But if you don't
mm,
know, you can do what's called post-exposure prophylaxis, or PEP.
mm. So times have changed definitely
Oh yeah.
with HIV, AIDS, and no one would ever know that anyone has it unless they said it.
No, I would defy you. I mean, our practice runs in a general medicine practice, and the residents and the students come in, and that is one of the things that they are so amazed at, because they'll see people in the hospital, but then they realize there's all these people that are just look fine, doing fine, look healthy, are healthy. And I think the message is, and part of ending the HIV epidemic is knowing your status, is getting tested, because still many people have not been tested or are avoiding getting tested.
Yeah,
No one wants to have that
of
diagnosis,
course,
but
of course.
it is, world's different. As soon as we are aware, we start people day one. You don't walk out the door without starting a medicine, and that
Right.
preserve your health and your immune system so that you can live long and live well.
Yeah. And I did get tested. It was years ago, but I was so frightened at the results. But it did come back negative, and I was just like, oh my goodness, this is great. So actually, we would be more of a threat to someone who has HIV or AIDS than they would to us, correct?
In what way a threat to
Like
them?
as far as, say, if we are carrying some type of illness, we could hurt them more so than they could hurt us, because like you said, you with all of the medications now today, they wouldn't probably pass away from the AIDS or the HIV. But if I had COVID and I passed it on to them,
Oh,
it would be more detrimental to them than it would be to me. Correct?
possibly. We saw, a lot of this is all coming out now in publications, but certainly individuals that did not have their HIV under good control tended to do worse. It's all about keeping the virus suppressed or undetectable.
Okay.
But you're still considered, to have some immune problem, because obviously you still have an infection. It's just controlled. But yes,
Right.
technically, something like COVID, you can, we have to advise everybody to try and avoid getting contact, but you
Right.
may be at a little higher risk if your HIV is not under good control.
And what tips would you have for everybody to prevent getting HIV or AIDS?
Get tested regularly, especially if you're sexually active. And if you are, and then if you're HIV negative, consider PrEP, because it can be very, very effective. They just had a conference and they showed, again, not necessarily similar to the United States, but in Australia, where it's a very contained, it's an island, but that with PrEP and early detection and treatment, that they've almost eliminated it in that country. So that's the whole idea. It's a lot tougher in the United States for all the reasons. People can't access healthcare, are keen on taking preventive medications. But I think knowing your status, getting treated as soon as possible, so then you're not at risk for yourself or to other partners, would be the biggest thing. And staying in care, because the other part we see is sometimes people get tired and they don't want to keep showing up at the doctors. But now if you're under control, you only have to come like once or twice a year. I mean, it's really,
Oh, wow.
yeah. It's not like you're in the doctor's all the time or the clinic all the time.
Okay. Well, thank you so much, Doc. I really appreciate you. And I thank you for hanging in there and making a difference. You are truly a community hero. Thank you so much.
Thank you.
Thank you for joining me today. It was great speaking with Dr. Tedaldi. She shed light on many aspects. If you know someone who has HIV or AIDS, you still love on them, because they are normal, just like you and just like I. But education is key. Testing is key. Take care of your body. Peace and love.